Top Med Talk.
Hello, and welcome to Top Med Talk. I'm Desiree Chappell, and we're coming to you with coverage of the COVID crisis from the front lines. Now, over the past month or so, we have had phenomenal conversations with care providers all over the world who are either on the ground themselves taking care of COVID patients or possibly playing a more supportive role in the battle against coronavirus. Now, we're going to continue as long as we can to share their stories and really hope to provide resources and support to all the healthcare workers out there caring for COVID patients. Now, we also have been coming to you with updates from the Top Med Talk team. So today I'm joined by our editor-in-chief in London, England, Monty Mythen. Hello, Monty.
Hi, Desiree.
How are you doing today?
Personally, okay. I'm just, along with my colleagues, a little bit saddened by an article that we've just been sent, which has confirmed some of our worst fears about what's been happening to some of our colleagues in the National Health Service. So, abbreviated to the HSJ is the Health Services Journal. So it's extremely well known to us in the United Kingdom, and its strapline is for healthcare leaders. So if we go to look for a place, if we've been involved in health leadership, particularly within the National Health Service, but health in general in the United Kingdom, this is our go-to place to keep up to date with what is happening from that perspective. Within that, we just sent through a link to this particular article, which is an exclusive written by Tim Cook and colleagues who we know very well through Top Med Talk. We interviewed Tim relatively recently about this. It's about deaths of NHS staff from COVID-19, an analysis of that he's performed with two colleagues you can find on the article.
Yeah, and we have that posted in the show notes, so we'll have a direct link to that. Can you walk us through in this article and walk us through it?
I think what's been very evident at work, and we've been increasingly hearing more about it on social media and now mainstream media, and now in the sort of verified scientific literature, it does seem as though individuals from certain backgrounds, and in particular Black and minority ethnic groups, are being hit harder. There are a disproportionately large number of fatalities from that group. And this article not only goes ahead to report the deaths we're aware of so far by the methodology, which we'll describe shortly, but also explores that side of it.
Can you tell us about the methods that they use? Because Tim is an anesthetist working kind of in the background in Bath there in England. And so he's not necessarily, what is his role or how did he come upon this?
So as it's described here, now we haven't spoken to Tim about this. I'm just reporting because I think it's important for us to talk about this and help to share it as quickly as possible. Tim Cook and Simon Lenane, who's I understand to be a GP, until the 12th of April was separately collecting data on this. And on discovering they had two data sets, they say here that they compared them and they found remarkable similarities between the two data sets. Now, the way they identified the cases, they were considered fully confirmed when a minimum of 3 separate news outlets and 1 social media outlet had confirmed the details of the deaths. So this is not typical verifiable data that comes from national statistics, but it's using news and social media sites to try and determine if they could verify, triangulate independently to do this. And they came up, it would appear to remarkably similar, if not identical data. So they've got this out there to prompt us to think much more seriously about it.
Can you walk us through some of the results and what came out of this look that they did?
I think an important thing to emphasize is the data is exclusively in the public domain. So they haven't made any attempts to contact families or the individuals or seek information, but this is the methodology they used. And what they found is consistent with what we've been hearing everywhere else. Mm-hmm. So they say that they found 119 cases. 13 cases were excluded using their methodology. In 4 cases, multiple attempts were made to confirm the information over several weeks and days. But when we cut a long story short, they get down to able to report from somewhere in the region of about 100 cases. Now, I encourage people to look directly at it, but in the interest of time, let's call it about 100 deaths of UK health and social care workers from coronavirus 19. So around 100 cases from UK health and social care workers from coronavirus reported in the media up to the 22nd of April 2020. Now, if I may, I'm going to cut through right the way through to the discussion points that they highlight. because they say that there are 3 key findings from this analysis to highlight in particular. First is the disproportionately high rate of black and minority ethnic individuals, BAME as it's often referred to, among those who died. Second, the absence of those members of staff considered to be at high risk of viral exposure and transmission. And by that, they mean us, basically, Desiree. They mean anesthesia providers, people on critical care, people who you'd think would be getting the very high level of exposure to aerosolization, etc. And then the final is the overall rate of fatalities compared to the general population and the proportion compared to the population that works in hospital. Here's the headline. The BAME individuals, black and minority ethnic individuals, account for 63%, 64%, and 95% of deaths in the same staff group. So should we pick that apart in a little bit more detail?
Yeah, a little. I think it'd be nice to break that down.
So again, encourage people to read it because it will get potentially more complicated, but they've broken down the broad categories of nurses and midwives, healthcare support workers, doctors and dentists, and then other staff. So for example, there is 35% nurses and midwives, 27% healthcare support workers, 19% doctors and dentists, and 25% other staff. If you then look at the BAME percentage, the black and minority ethnic percentage, who have been confirmed died, of nurses and midwives, it's 71%. Of healthcare and support workers, it's 56%. Of other staff, it's 29%. And for the doctors and dentists, it's 94%.
Wow, 94%.
94%. Now, the important reference point within that is, although let's take nurses and midwives, for example, 71% are from black and minority ethnic group. Of the whole workforce, they make up 20%. So there's a disproportionately big skew towards that. Yeah. I'm sorry to go straight to the doctors and dentists because it's the most shocking number. The age is 62, but a range that goes up closer to 80. 94% are male and 94% are black and minority ethnic groups. Now, the BAME workforce in the NHS does make up quite a high percentage. It's 44%. But there's, again, a massive skewing towards this being a major risk factor.
Mm-hmm. Gosh, yeah, the age is scary, but the ethnicity story is really...
Now, we're giving out a lot of numbers in a podcast here, which is going to be hard for people to digest. But so if we go then to some of the other headlines, and we should come back and discuss this another time, but encourage people to pour through this more closely, is as a result of this, a government inquiry, not directly as a result of this, but this whole story, a government inquiry has been established, and that's required to act at pace. Because this is one way of acquiring data. There's absolutely no reason why we shouldn't be getting this data from properly confirmed statistics. But from everything I've seen personally, everything I've heard and I've read, I'm very sadly not surprised at this.
No, but it's good that there's an impetus for it, that they are taking a look at.
Absolutely. They then highlight the fact that a modest estimate of patient-facing NHS workforce might be 600 to 800,000, which is more than 1% of the whole UK population and more than 2% of the employed population.
Wow.
The other thing, which I think is the most important fact of this report, they've already heard that there's been no reported cases in this cohort of people that were in those groups that were in the area that everyone's been stressing most about. And that's where you wear PPE in, for example, intensive care, to, for example, put a tube down into someone's lungs to help them to breathe. That's where we would, in recent years, always be wearing PPE to perform these things, but now we've spread that penumbra of protection of ourselves from the patient to be much bigger than that.
Yeah.
So it looks like the PPE is working and is important and must continue.
Yeah.
But the paragraph here I want to highlight is it's not possible to know whether infection occurred at home or at work. So these individuals were not in that group.
Yeah.
So they got it probably at home or at work. They have determined the vast majority of individuals who died had both patient-facing jobs and were actively working during the pandemic.
Yeah.
And as you know, this is something I got very, very stressed about.
Yes.
And I was reporting it in the podcasts. When we first interviewed our colleagues from Italy and Bergamo, it stuck with me that when they said we took down our healthcare system, we infected each other and we infected our community. Now is our big opportunity in the wake of this report to not let this continue. Mm-hmm. It's heartbreaking. We have to recognize the fact and continue to think we've all got it, we can all get it, and we can all give it.
Yes.
Because they may well have got it from their colleagues at work.
Yeah.
I'm not saying they did, no one can know that at the moment, but you'd have to say on a balance of probabilities, it's high on the list.
The biggest thing that I take away as a healthcare provider myself is, first of all, this stimulates a very important conversation and it gives us a platform to jump from, because sometimes we find it difficult to talk about minorities and ethnicity in the realm and guise of employment, but it's something we have to address. Also, personally, how we consider protecting ourselves, I guess, when we're at work, and then protecting our loved ones. And if that means that we have to wear a mask everywhere we go, then that's what that means, to protect, not necessarily to protect ourselves, to protect other people from us, because we are probably carriers of it.
I've said it and written it in many different places. I still stick to it. I celebrated the fact that when we heard from the Boston area that certain hospitals had gone compulsory mask wearing within the hospital environment, I think we have to do that now. Yeah. We have to turn around and say, I'm wearing this mask outside of where we wear PPE. I'm now wearing this mask for you, my colleague, right, you, my patient, et cetera, et cetera. So, very, very sad, all of this, but lots of important learning from it going forward.
Absolutely.
Sorry, I'm a bit upset by this.
I know you are, Monty. And well, again, this is something that you have been talking about from the beginning. We have been talking on Top Med Talk from the beginning about all these different, issues. And so it's real, and it makes this report makes it even more real, I think, for many of us. So I suggest we get off the line and get this out there. I know most people will pick this up on social media and by different routes and by the popular press's interpretation of it. I know that loads of people in countries are living through all of this as a reality right at the moment. Let's think seriously about not only continuing to wash our hands, but getting our mask on for each other when we get to work. And then let's come back to those other questions that we were going to try and handle today about hyperimmune, fresh frozen plasma, et cetera, et cetera. Yeah, and resuming surgery, I think, is a big one that everyone's talking about. That will be one of the new front lines. As we go into that new front line, let's reflect on all of this. Yes. And let's learn from the countries that seem to have done this so much better than ours or yours, from the point of view of recognizing the contagion of this virus. As I said, it's going to take a long time till we work out whether that's true or not. But let's do simple things well now. Yeah. Yep. Agreed. All right. Well, thank you so much for listening to Top Med Talk and listening to this update today. We really appreciate everyone for what you're doing on the front lines. You are keeping everyone going. So thank you for that. Please follow us on topmedtalk.com or on your favorite social media platform. Stay safe, stay well. We're going to get through this together. Thank you so much for listening.
Top Med Talk. Top Med Talk is proud to thank its sponsors, specifically Edwards Life Sciences, for their generous support through this global crisis.